Hey, this is a hamstring release with a sciatic nerve glide. So I have a ball here, and I'm gonna get this in the hamstring muscle belly. I'm gonna start by just kind of rolling back and forth until I feel like a trigger point or like a massagey spot in the hamstring. If you're having symptoms, I'm not looking to elicit those. So I don't want anything that's sharp, numbness, tingling, anything that intuitively feels disconcerting. It should be sensitive, but in the like hurts so good type of way. If you're not sure what that is, move to a different spot or just omit the ball for this. We're not looking to cause any symptoms here. So once we find that, we're gonna like, oh yeah, that's a little sensitive. I'm gonna add a leg motion that is what's called a nerve glide. So in this bent knee position, I'm gonna pull my whole foot up to the ceiling. It's called dorsiflexion. And then I'm gonna straighten my knee and point my foot into what's called plantar flexion. Bend the knee, pull up, point, and straighten. I want to typically have my foot fully pointed before the knee is straight and then have it pretty bent as I pull my foot up, meaning I'm not keeping it here and then pointing. I'm getting my foot pointed as my knee goes up and before it's straight. I'll do this for 20, 30 seconds, and then I'll find another spot in the hamstring. It's like, ooh, that's a little tight through there. Should again be in the kind of sensitive, but ooh, I'd want a massage therapist to work on there. And then I'll pull the foot up, point as I straighten the knee. If you feel a stretch or discomfort, the first thing to check is, did you reverse the foot motion? If you have, just point the foot. Are you pulling the toes back and the foot back too soon? If so, point the foot. Second thing would be to lean back. And if you're still feeling it, then I just won't straighten the knee all the way. So we're playing with various kind of causative factors of nerve tension with these body positions. Ideally, we can do it with the feet hanging, but I can also go from a chair. It's not perfect, but I can still get the ball kind of under there. I get a little bit of a slouch almost, and then I just kind of work through there. Not ideal, but totally doable if you can't find a countertop or a sturdy desk or table to work through. So that's the technique. I'll typically go 3 to 4 minutes a side, working kind of throughout the whole hamstring muscle belly, wherever feels relevant to you, and just working this rhythmic foot and ankle and knee motion. So a couple considerations and or why are we doing this, and things I see often are done that might elicit more symptoms. So this is what I personally call a nerve glide. And so nerves are like wires. The sciatic nerve comes out of the back, runs through the glute down the back of the leg, crosses the knee. At the level of the knee, it branches. The branches are called different things, but it's all one chain. There's one branch that goes to the top of the foot, and then most of the other branches go around the heel and into the bottom foot, into the toes. So in a very real sense, the tips of your toes, there's a connection point all the way up to your hip and then to your low back. There's enough slack in that nerve, in that electrical wire, to accommodate most normal body motions. However, if the nerve is sensitized or irritated or inflamed, or if there's something along this whole chain that is sensitized, irritated, or inflamed, the nerve doesn't slide as well as we move. At least that's the theory anyway. And so with the ball, we're working in just creating maybe a little blood flow or changing the tension in the hamstring muscle. Often intuitively feels pretty good to do that. And that can potentially free up how the nerve moves through and underneath the hamstring. Then with the knee and ankle motion, what we're doing is specifically using what we know of the neuroanatomy to slide the nerve up and down. So especially if I've worked with you, I've often showed you a picture where the foot pulls back, knee is straight, and that pulls this nerve super taut all the way through. And so I actually, in my opinion, the classic sit and reach stretch is not a hamstring stretch, it's a nerve stretch. Because most people, if I feel tight here and I just relax my foot and ankle, the hamstring stretch dissipates and I can go a lot further. So if the hamstring tension changes when I change my foot and ankle, we're more likely working with the nerve than the muscle, because the hamstring ends at the knee, it does not go down to the foot and ankle. So if I'm changing what a stretch or tension feels like in the thigh or low back, then it's not my hamstring, but it's the nerve. And so I tend to find that nerve tension, stretching the nerve, can create irritation. Sometimes that irritation is in the moment. Ow, that's uncomfortable. Often nerves have a delayed onset irritation, and so it can feel like the right thing to do to stretch them because they feel tight. Sometimes the stretch even feels okay or good in the moment, but that can lead to a delayed onset increase in irritation or symptoms. Sometimes it's an hour or two later, sometimes it's in the evening, or sometimes even into the next day. And there's some theories on that. It's potentially due to called neuroinflammation, so chemicals in cells that irritate the nerve. Still some debate about that, but regardless, nerves can have a delayed onset symptom response to things that we do. And I find that nerve tension, at least in the early stages of an injury, can potentially irritate things. And so often I'll test, is there symptomatic nerve tension? And then I want to work with this glide technique to help settle that down. What I often find is people are either instructed or on their own will do what's called a nerve tensioner. Well, they'll intentionally pull into this nerve tension. It often will loosen up just because we're creating some motion, some blood flow, but they might get symptoms later. And so there's some activities such as dance or the aerial arts or gymnastics where I might need access to these nerve tension positions. There's some ways I work to restore them, but I don't stretch into them, at least not early days. I might go into that late stage once I know that everything is calm, that the nerve has low likelihood of flaring back up. But if I'm not sure of what the feedback loop is, meaning I'm not sure what's causing symptoms, or if it's early on in the rehab process, or kind of it's irritable, it's easily aggravated, then I typically stay away from these nerve tension positions in seated or in standing. And often I even limit pure hamstring stretching because that can pull on the nerve. And so kind of a long discussion here, but I find that pointing, that relaxes the nerve at the ankle, a little tension here, and then I pull my foot up, pulls the nerve to the foot while it relaxes here, and then I can lean back, which reduces tension there if I need to. And often over a few minutes, the tension starts to go down, and over, usually do this up to 3 times a day for a couple of weeks, and a lot of that nerve tension starts to subside. We might not even need to stretch at all to restore that range of motion. So that's kind of how and why I go through this technique, and why some of the reasons why I stay away, at least early days, from some of the nervy tension positions. Last thing I'll mention is that the peroneal nerve, or the superficial peroneal nerve, goes to the top of the foot. It's not as common, but sometimes there's an irritation in that nerve, and it actually feels worse and tighter in this straight knee pointed foot position. That's a very specific presentation, and if we're seeing that, I might do a peroneal nerve glide where I do kind of reverse this and do what I told you not to do, but that's a specific case, and if that just kind of lost you what I said there, disregard it. But just noting that sometimes for a peroneal nerve injury, I would change this technique, and I have a different video on that. But in most cases, particularly when we're dealing with hamstring, hip, back pain, that this kind of standard nerve glide technique tends to work pretty well because there's not an additional peroneal nerve issue down at the leg. But you should not feel symptoms, you should not feel stretch. And if you're feeling a hamstring stretch as you do this, I want to first make sure we're not reversing the motions I'm talking about, and then lean back, or just don't straighten the knee all the way. That's probably the biggest mistake in some neurodynamic techniques, is that people seek out a stretch, because I think societally we're trained to think that stretching is a good thing. It's not inherently bad, but in some cases it can contribute to symptoms. So anyway, hope that all makes sense. The technique, though, despite all of my jabbering on here, stop the ball, we'll let it go, is fairly straightforward. But the explanation of the reason why I find often takes, I like to walk through that, because sometimes people are told a different thing, or what you're feeling is maybe counterintuitive, and we want to stay away from that stretch. So give it a shot. Of course, check with your healthcare provider if you're working through pain or an injury, and don't continue if it causes symptoms, makes you feel nervous or disconcerting in any way. But if it feels good, sometimes I'll go 3-4 minutes up to 3 times a day, usually just once or twice. But if it reduces symptoms, you can add a little more frequency.